when it comes to the young parents or the new parents, they're very worried about, the development and the growth of their kids. And of course, when you are a new parent, so you naturally you do not have that much of experience about how to rear up your child when it comes to that. So definitely you need a lot of help, especially when it comes to, the nutritional growth of your child and other problems that your child faces. So to address all of those problems, we brought in someone, from the Peds department, who happens to be Dr. Qamar Ali Sahab. You wanted to add something?
But let's just first.
So I want to introduce him. So Dr. Qamar Ali, Assalamu alaikum, and thank you so much for coming to our show.
Walaikum assalam.
So thank you very much for joining us, and you've got quite an experience on your hands too as well. You've been in UK, you've been in Pakistan, you've been all over the world looking after kids from almost every walk of life, and I think that's great too as well. Right. But what we really need to consider over here is that the weather is changing. There's a transition in the weather. We've seen monsoon rains too as well. Some days it's hotter, some days it's colder. And so we really certainly cannot identify whether we need an air conditioner in our room or whether we need to turn it off, whether we turn it on for a smaller period of time and then turn on the fan and utilize the both. So, which I believe is kind of affecting our health on every single day basis too as well. Let's talk about gastroenteritis, let's talk about hepatitis, typhoid, diarrhea. All of these are the diseases which obviously, can be really lethal if they're not looked after in time too as well. So first things first, I want you to kind of explain how the weather is transitioning and how it's going to have an impact on our babies, kids, children who are out there.
Thank you for inviting me, and it's nice and my pleasure to be there with you in the morning show. So you see, coming to this topic of discussion that you have chosen, and for that we need to see monsoon, and we all know that from June till end of September there is a monsoon, and it is the part of this area, the change of weather, and it's a very classical weather for our area. And in this weather we know that it is becoming damp. This is a torrential rains are coming. So if it is coming, and we know in our country what is happening, water is bubbling everywhere.
True.
Once water is bubbling, what it means, sewerage system is mixed with sometimes drinking water. So it means that the thing is it is a conducive environment for the the bacteria or the organisms that can cause diseases in the children. So I would say that because of this damp environment, and then the vulnerability of the children, then the circumstances and the situation in our area, and also one thing that I can explain further in the end.
Sure.
And I would say that from today's discussion, if we have given this message of WASH, WASH, WASH. Have you heard about this WASH strategy?
Wash, okay, W is for wash, what is A for, what is S for, what is H for?
So WA is standing for clean water access.
All right.
Okay.
So this is actually, every child has, the right to get, the clean water. WA. S is the sanitation, and H is for hygiene.
Okay.
So WASH strategy is a known strategy by the UNICEF adopted to clean the world by this strategy till 2030.
Okay, wonderful.
And before even coming toward the diseases, because I believe that this is the most important, this will be the most important message that we can deliver, and hopefully we will deliver through this talk today. Is this WASH is, this is a half religion.
Yeah,
that's true.
And it costs nothing.
That's
However, it costs because definitely bring the availability of these things. Yeah, because again coming in the school we have these diseases that we are going to discuss. Where they are coming from, where they have the more tendency or the chances to spread in our communities, the school.
True.
Right.
You know they just opened up recently. So kids are going back after summer vacations.
And people, we know that in the school things spread like the wildfire.
That's
true. That's true.
Even if there is any new lingo, if there is a new dialect, you will see your children, they will demand only your children will demand the new thing that is in the market, that is expensive, that is not available. From where they're coming, they're bringing from school. Same way, unfortunately, happening for the diseases as well. So the germs also, they are fasting very quickly, and they are bringing in the community from the schools, because all of the children in the environment are there.
Like how germs are attending school too as well.
Exactly.
Pade likhe germs are.
Because we believe that the friendly attitude, friendly behavior,
Right.
friendly atmosphere.
Right.
What is that friendly? That sometimes we share the things.
Right.
Even the earpods that you are wearing, huh?
Right.
Even if definitely from the home you will be keeping your brush separate, but the water bottle, you're
Right.
sitting together.
When we go to
very
school,
near.
everything's
Yeah.
shared.
Yeah. So
That's
because there will be that will be the criteria of the good friendship.
And we
Right.
tell our kids,
Sharing
Yeah.
is caring.
Yeah, sharing is
and we
caring.
tell our kids, bete,
Right.
please make
Yeah.
sure that you share it with your friends too as
Exactly.
well. So
Right.
that's a
Exactly.
valid point.
So, again, accumulating and bringing back and coming back toward the name of the diseases, I would say
Right.
that in the morning talk, if
Right.
we are going to speak about the etiology, like the cause and the pathogenesis and
Right.
how they are happening, no
Right.
need, I suppose,
Yes.
for the general public. But we
Right.
need to know, and we know that there is a gastroenteritis, this is a stomach flu, this is a typhoid, this is a hepatitis A,
Yeah.
and there will be the diarrhea,
malaria.
dengue. So all these diseases are always there.
Right.
If you speak about the dengue,
Right.
I was just reviewing the literature. 1994, there was no dengue in Pakistan. 2010
Right.
started pick up of the dengue. I remember, I was living abroad. I never know
Right.
about the dengue in
Lahore,
Pakistan. Then I came to
Right.
know, dengue is happening in Pakistan.
Right.
There's so much fear. So what to do with the dengue? Basically, there is a 4S strategy.
Sure.
Right.
Basically, in what we need to do is to just identify, because when there is a monsoon, water is stagnant there. And
Right.
stagnant water is the breeding place for the mosquitoes. And mosquito is a vector that can take and bring the dengue virus and infect the
Right.
people.
But sir, they're so advanced now that the dengue mosquitoes are actually now born on obviously still water, but that water
Clean.
needs to be clean. That's what the problem
When
is.
there's stagnant water,
Yeah.
I mean, when there is a monsoon, there is a water. So stagnant water is a breeding place for the mosquitoes.
True.
That
That's
basically the mosquito is not cause of the dengue virus.
Okay.
It is basically is a vehicle. It's basically taking and bringing the
Transporter.
virus transporter. Yeah.
Medium.
Right.
So, again, coming toward the malaria. So what we need to do is ask the children to have the full sleeve.
Right.
Okay.
Stay away from the breeding places, and
Right.
the community, our government, over the local, the people, they need to make sure that there is no places where the water is stagnant.
True.
Right.
They need to keep the flow
It's
of the water.
It's difficult considering it's a
Yeah.
monsoon season and
Yeah,
there's a
I
lot
suppose,
of rains. Yeah.
But I remember
Imagine how
since the
people of Karachi
childhood,
might feel.
since my childhood, we
Right.
are listening. Flood.
Right.
What our government, what our policy makers are doing.
Yeah.
They need to do that because we always know that every time know that since
Right.
from the start of the June till the September, what is happening? Monsoon is coming, water
Right.
is coming. Some water from our own country, some water is being sent by our neighbor
That's-
friendly countries also as well for the friendly purpose. I know.
Sir, okay, I'm going to partially agree to this as well, but partially I want our audiences to understand this phenomena too as well, because we have done quite a lot of shows over here. When we say that, why nothing's been done by the government, when we talk about the flooding too as well. So the most important part is that by PDMA and NDMA advisories are being released that, that people are actually supposed to leave the places where it can be flood prone. Now, what happens is that, to actually have the underwater recharge, we really need to have these floods too as well. These are important because we only have a 60-day of storage, right? So when we only have a 60-day of storage, we really need to go through the year. So, these floods important for us too as well at the same time, but just floods without any sort of disturbance and destructions is something which we're looking
Of
for.
course, we need to manage and make
Yes.
how we can create an opportunity out of the crisis there. So moving back to the
Yeah.
kids' health.
Yeah, we will not go to that politics, but believe me, I'm always
Yeah.
optimistic, and
Thank you.
I try myself even to praise somebody first and then to
Exactly.
criticize.
Exactly.
I'm sorry I have
So
started
for
from that
malaria,
way.
full sleeves?
Malaria full sleeve.
No
Yeah.
stagnant
Then again
water?
to avoid, the stagnant water, and then definitely when you see some type of the symptoms are coming, early advice.
So what are the symptoms? Let's talk
Symptoms
about them
that is a
quickly.
fever, and
Right.
then you have headache,
Okay.
pain behind the eyes,
Right.
body pains,
Right.
high grade fever, and now. If you see the data all over the world, 400 million people all over the world, they are being infected by the dengue.
Okay.
Out of them, 100 million people, they will be sick. Out of
Right.
them, only few percentage become very sick or hemorrhagic disease. And I know once when there is a patients coming to us in the hospital, they already know and they ask us to please do the dengue virus test, please,
Yeah.
because they know that.
Right.
And what is happening when it become more, problematic is when there is a bleeding started.
True.
Right.
However, many of the cases, they are being treated with simple symptomatic care, IV fluids,
Right.
paracetamol, nothing is required.
Okay. So, sir, dengue and malaria, do you think that they have a correlation too as well?
It is different because the malaria is happening from another, there are 950 species of the mosquitoes.
Okay.
Few of the species, they carry the dengue and few of them, they are
Right.
certain types, they're carrying the malaria.
Yeah.
So malaria is a
Right.
disease from the mosquito. That's why we are just sometime saying that they're same, but they're different.
Right.
We only thought it's only humans who have different faces. I
think you would be surprised, how nature has so many variations when it comes to
950 species, that's quite a lot.
Right.
Yeah.
And so, that too, they're so small that you can...
So, the nature, if you start reading the nature, you will see and such things, you will explore the things.
Okay, so coming back to, especially the kids, who are young and between the age of 3. So, most of the time, I think Shahzad is a father and he will know better that, they are throwing tantrums and they do not exactly know, how to manage their emotions or, express themselves when it comes to that. And unfortunately, what happens is that a lot of parents, just in order to, so that their child does not, shout or create a scene out of it, they sort of reinforce that the negative behavior, if he is shouting and screaming that he wants particular thing, the children will give them. So you are the doctor of the kids. As a peds, how would you advise, how do you think that, parents teach their children how to manage their emotions?
You see, from the emotions, even only yesterday, one child came to my clinic and mother and father, they were so panicked. I told them once I was in Ireland, one of the nurse, she told me, because being a father, I'm a father of 3 kids. When they were younger, I was also behaving like maybe like Shahzad or anybody. So honestly, that she was good. People learn, people know, people observe, and the only eyes can see if your mind knows. So the thing is that if somebody understand, anticipate, empathetic to the people, then you can advise better. So I was even telling the parents, try sometime ignore. Not, you don't need to just restrict your child. They are not robots. They have their own personal emotions that they can be diverted.
Or probably respond to their emotions every time.
So you need to improvise rather than you need to think and then try to make the child act like that. It's not possible all the time. Children, they are not, listening you. You have to make the children their activity and then improvise their activity to your goal. I would say that this is the way you can deal the emotion of the children rather than forcing and making your own mind and then bringing the children to that line. It's not possible.
Because
it's not going to happen.
What they do is what they see you doing.
Exactly.
So that's exactly what they're actually going to do too as well, and then question you for that too as well. But now, sir, coming back to typhoid, because you spoke about how bubbling water and the sewerage water is mixed too as well.
Yeah, it's very important. 20 years back, I remember when I was working as a house officer in my hospital, National Hospital, we used to see the patient in the ward with a gastroenteritis. Rotavirus vaccine is in the EPI program in the Pakistan, optimistic approach that I'm telling you. Now coming back to the Pakistan, we are not seeing so frequent patient. Meningitis patient were very common in that time. Now vaccination is there in our EPI expanded program of immunization. And children, we are not seeing such disease in them. However, typhoid, hepatitis A, they were not in our vaccination schedule. Recently, because of the surging typhoid cases started from the Sindh government with the, the affiliation of Gavi, the vaccination program, it is now entered in our national program. If you know that, 9 months we are giving conjugate vaccine for the typhoid conjugate vaccine. So that will help in the future coming days to avoid the typhoid happening in our community. However, hepatitis A is still not in our vaccination program. And we are, I'm also doing pediatric hepatology, liver disease patient seeing in Shifa hospital. So we usually come across to see the patient with hepatitis A. Usually many patients, they will not come to the hospital. In the rural areas, they will not come to the hospital. They are they're treating themselves, they're curing by themselves. It's a viral infection. But sometimes it is a lethal disease. Liver failure, need liver transplant. We recently had 2-3 liver transplant after the hepatitis A. So I would say that hepatitis A, because the vaccination is the investment of the parents on their children for their good health. Because healthy children is, they are good for the future. Health is important for the children, then they will, bring out everything. So I would recommend that hepatitis A vaccine, all of the parents should go and give to the children. However, this is the one type of the, the prevention. Other infection, the prevention, as I mentioned you in the beginning, is a wash. Clean water, sanitation, hygiene. If you see the data in the world, we are living in an area where is half of the world is living. India, China, Pakistan, subcontinent, 4 billion people. And out of that, if you see that the data, I will tell you 2 billion people in the world, they have no access to the clean water.
That's true.
4 billion people in the world, they are not using clear, the sanitation properly. 1/3 of the population, they are not properly using the soap
Exactly.
You know, while doing
or how
the
to wash
washing.
hands even.
And you know that exactly, I remember the number is 947 million people, they have no access to the proper toileting. They are going outside to
So
do
almost
toilet.
1 billion,
Yeah.
Yeah.
So you need the fecal matter. F, it can be spread, you know, from the fluid,
Right.
like in the water,
Right.
in the fields,
Okay.
outside,
Okay.
then the flies,
yeah.
Right.
fingers, and then it will enter into the food, F again, and then it will go to the another host.
Yeah.
So you're the fecal matter that we sometimes you see that the new mothers, newborn babies, only in the breastfeeding, dealing with their pampers, think that that stool is okay because but the baby is always on the milk and is a pure. No, that is also not pure.
Right.
So you need to clean your hand properly with the soap. Hand
Exactly.
wash is very important. Then you're dealing with the, you know, the house stuff.
Right.
So I would say that this wash is the primary prevention that can avoid all these things being happening.
Exactly.
Right.
And so very quickly towards the end of this segment,
Right.
thank you very much, you know, because you really
Right.
make us understand it very well too as well, where how important it is for us to wash. When we speak about wash, it is obviously clean water and then hygiene and then sanitize too as well. But what I have seen, you know, as a father, you know, after post-COVID, we have seen that, you know, that, you know, a lot of children have developed these different type of syndromes, which still are new to the medical studies too as well, and the pediatricians were unable to figure out what's wrong with the baby. Same happened with me too as well. And they were like that, you know, it's a post-COVID situation, we are still working on it, we're still researching. So, you know, she had difficulty breathing and, you know, her oxygen saturation levels were going down. So the symptoms were similar to COVID, but the COVID test out again and again came out negative too as well. So for all of those parents who might be in trouble as of now, whether what's wrong with their kid, what do you think is the best possibility for them? How do you think that they can verify whether, God forbid, if he or she has developed any other disease or something? So what is the procedure? What is the SOP for that?
Thank you for this question, and I think it's the most relevant question of the present time. And I have recently seen one patient, even a father has to fly from Washington
Exactly.
to see his daughter. And I can understand the, you know, the worry when the children are sick, parents wherever they are, they will come and see. In that child, I will give you the particular example that you will understand. That child was having typhoid.
Okay.
Now, as I mentioned you before, typhoid is emerging in Pakistan as a multi-drug resistant typhoid.
Right.
What that means that the typhoid will not be treated or cured by the, you know, the traditional antibiotics that we normally use to treat the,
True.
you know, the infection.
Right, right.
Then we have to use the upper class of the antibiotics. That is called, and then we have the less, you know, the limitations.
Right.
So that is the MDR, multi-drug resistance typhoid. That girl was having typhoid and she was being treated by the 2-3 weeks, and she's not getting better, and they
Right.
brought in and they called me. I was on call. One of my registrars, she called me. This is the
Right.
patient, was on 3 weeks, ceftriaxone antibiotic, not improving. I said, do the, you know, the COVID panel. Because nowadays, we are seeing the children coming post-COVID. They were not having any problem when they were having the COVID disease
Okay.
itself in the beginning.
Okay.
But after some time,
Right.
they are developing a type of the disease that you are saying and mentioning. It is known
Right.
all over the world now,
Yeah.
in the UK and even Pakistan. In our own center in Shifa, we have 200 cases already, you
Right.
know, recorded.
Yeah.
What is happening, because of the post-COVID, they are developing multi-system inflammatory response.
Yes.
So MISC-like, you know, the
Right.
disease. So if you are not treating to that, you know, the association of the disease, you will not be treating your typhoid, or even we have seen many patients with typhoid,
Right.
hepatitis A.
Right.
So hepatitis with MISC, typhoid with the MISC.
True.
Even I have seen multiple patients with, you know, this pancreas disease, or even with the blood diseases, anemia. So there are multiple associations.
Yes,
So you
yes.
need to understand, and you need to keep that thing in your mind, being a physician, to treat these children. Unless you know not do that, treat the children like that, you will not be able to treat them.
Exactly.
So that's what
Right.
happened, and she was fine and she was cured. And many of the children, I can say from my personal practice and my colleagues, you know, they are expert also in the infectious diseases, and they are doing, and we are treating. And fortunately, they are doing very better, very
Exactly.
well.
Wonderful.
And there is very good outcome.
Exactly. And while you were talking about it, you know, I was exactly trying to think the name of the syndrome too as well,
Right,
because
right.
multi-inflammatory syndrome, I think that's what we're calling it too as well. But it was in a very later stage that we were able to figure out. My daughter had to be hospitalized for at least a week's time as well. But I'm glad to the doctors at Shifa because what they do is that they work together. And not just that, because while the pediatrician was unable to figure it out, he actually called in his professor who was 90 years old. He came in and he saw the daughter, and then he was like, okay, probably we need to think somewhere outside the box too as well. But thanks to Allah Almighty. But for all of those people who are out there, the symptoms were that the oxygen saturation was going down. There was fever. They were saying that it might be any sort of infection too as well. The doctors initially they tell you that it might be UTI or it might be any other sort of infection. But if all of these reports come out negative, please make sure that you keep in mind that you ask about MISC too as well. The treatment wasn't available back then, so we had to give her steroids. And then later on, alhamdulillah, she kind of started to recover too as well. But now, alhamdulillah, because you're saying that 200 or more kids, God forbid, have had this, so now the treatment is readily available. So for all of that, people who are out there and were struggling, please make sure that you keep that in mind, you bear that in mind too as well.